Good afternoon, everyone. This is Dr. Bhupesh, your OET mentor, and today we are going to discuss about OET. So when introducing OET, I would like to take this empty page where we would be writing everything down. And after this 1 hour of class, whatever we understand, because I won't be able to explain you everything in the first class, but after this class, we will have a discussion of 5 to 10 minutes or maybe 10 to 15 minutes. That does not matter. If you have questions, you would be able to ask your questions. We would plan, we would try to plan how we will go in the next 2 weeks, and also will plan how would we go in the next 2 months after 2 weeks. So there would be, we will divide your syllabus into different parts. So I'm recording all this lecture. You would be getting the recording. At the same time, you would be able to ask your questions at the end of the day of this lecture. As we commence is a word we will also use in OET. Commence means start. As we start our OET journey, it is very important that the first day should be very productive, because if we understand the first day, then we feel like studying the second day. If we do not feel good about the first day, we feel like it's piling up. Piling up means it's getting together, but we are not understanding anything. So at the end of the day, when we will discuss these things, if you will have any questions, you would be able to discuss it with me. So first of all, I would like to introduce to OET. Again, we will not do everything in one day. You don't have to remember, you will get the recording. Just listen to it patiently like a story, and you will learn a lot of things within today. So OET has got 4 modules, as everybody of us know. It is reading, listening, writing, and speaking. First of all, we should understand why do we have 4 modules when it comes to any test. When we talk about PT, when we talk about IELTS, why these 4 things? Because to understand that someone knows about a language, there are 4 things. We should be able to read, we should be able to listen, we should be able to speak that language, we should be able to write. That is what they exactly want when you will reach to UK as a registered nurse. They want you to read well, they want you to listen to the instructions well, they want you to write the emails well, and they want you to attend the patient well. So that will happen in the speaking. So today, majorly, we will discuss about the writing module. So while introducing this module to you, I would like to tell you one thing. It would be in the form of a letter. Just one letter will come in your OET exam. That will be of 45 minutes. And you just have to write only 180 to 200 words. That's it. In OET, you will have only one letter, 45 minutes, which is like lot of time, ample amount of time. It is more than enough. And you just have to write 180 to 200 words. They want you to write in the sentence form. Sentence form means you will get a question paper. Like suppose if I'm going to pick any of the question papers from here, whatever I have got, let me take one of the question papers like this. Suppose if I take this question paper. This is little tricky. I'm just going to take another one so that it should not be haywire. Let's take this way. Yeah. So I'm taking this question paper. So you will get the case notes of the patient, that the patient is having pregnancy and is having substance abuse problem. And it would be given that Mrs. Amy Vineyard is a patient in your case in care. She is 6 weeks pregnant with her first child. She presented 2 days ago requesting help for her substance abuse problem. That means this patient has come to you. This patient has come to you with a substance abuse problems, and she is pregnant, 6 weeks pregnant. She reports a desire to reduce or cease her alcohol consumption. So the patient has come to you to decrease alcohol consumption and to reduce her drug use. That means she is not happy with the drug use since she has come to know about her pregnancy. No desire has been indicated. No, this is not a main line. She now wishes to be discharged. So the patient was admitted to you. She was 6 weeks pregnant, wanted to reduce her drug use. And this is one of the trickiest letter of OET. So I'm starting with the letter which is little difficult, but if you can understand this letter, you would be able to execute any letter. So just your concentration of 15 to 20 minutes. After that, I will ask you everything and I will try to resolve all your doubts. She now wishes to be discharged, but will require ongoing support throughout her pregnancy. So if you understand this thing, this is the main purpose of the letter, that patient came to you to reduce her drug use. Now the main thing is that she requires ongoing support throughout her pregnancy. So this is the main purpose of the letter, that during her pregnancy of 9 months, she wants support. So each and every letter is different. The first thing where you do in your OET writing is to understand what is the purpose of the letter. If you can figure out the purpose of the letter, it is 90% that you will pass. So it's just about understanding the purpose of the letter. So in this letter, I can understand that now she wishes to be discharged, but require ongoing support throughout her pregnancy. So that is the main thing of this letter. Now I will go to the last of the page, because last of the page contains the most important information when it comes to OET exam: to whom we are writing the letter and why we are writing the letter. To whom we are writing the letter is the most important thing, because if I am writing the letter to a physiotherapist, then I will talk more about ambulation. If I am writing to the psychiatrist, I will take into account more of the psychological issues. If I am writing a letter to a social worker, I will not like to include too much of medical data, but will let the social worker know that this and that follow-up care is required. If I am writing to a general physician, then maybe I want the medications to be monitored, the medications to be given. So it is according to the person to whom I am writing the letter. So what you need to have in OET writing is a mindset of a nurse. If you are writing to a psychiatrist, you will include the psychological issues. If you are writing to the physiotherapist, you will write about the ambulating issues, that whether the patient is able to ambulate or regarding the mobility. So this is the most important thing. So if you will write the whole words of this letter, it would be around 300. You just need to write only 200 words. So that means you have to make your exam very easy. If you can understand this one thing, that you have to make your OET exam easy, you will never find it difficult, no matter what kind of letter comes. So now I can see that we are writing using the notes, write a letter about Mrs. Vineyard's situation. So I have to write about her situation and history to the new community health nurse. In foreign countries, there are community health centers. What we do in the community health center is, in community health centers, patient go over there for the monitoring purpose, for the observation purpose, for the follow-up medications. So in foreign countries, we have community health centers where patients extra care is done, like giving medication. So because in foreign countries, doctors are very busy. So patient does not go to doctor every time. So whenever, for the small things, for the regular checkups, there are community health center. So you are writing the letter to the new community health nurse. So there would be a nurse in the community center, and you are writing the letter to the nurse talking about Vineyard situation. What is her situation? We already know. We know the situation, that she is 6 weeks pregnant and she has a desire to cease her drug use. That means to stop her drug use. That is the main desire. And now she will require the ongoing support throughout her pregnancy. So these are the main lines I have picked up. I have not read the whole letter, but I have understand the crux, the gist, the summary of the letter, that what is the main point. The main point is that I am writing a letter to a community health nurse which will take care of the patient, who will take care of the patient throughout her pregnancy. So that is my main aim. Once you figure out this purpose, you are all ready to pass your OET writing exam. So OET writing is that easy that once you understand the purpose, it is very likely that you will pass. Going further, now I will try to read more about the patient. Mrs. Vineyard, she is just 21, admitted on 6th, discharged on 8th. So today's date is always the discharge date. So we are discharging the patient on 8th of January, and she was admitted to our place 2 days ago. Why? Because she was pregnant and was having substance abuse problems. So that was the main thing. Again, the reason for admission has been given, that patient self-admitted due to the concern about pregnancy. So the patient was concerned about pregnancy, confirmed the pregnancy test a day before, means on 5th of January, she got to know that she is pregnant. On 6th of January, the very next day, she got herself admitted and she reported the lower back pain, weight loss of 6 kgs over the last 2 months. She was having some memory loss. She was having tingling in feet, difficulty sleeping, excessive worry and hallucination. So that is why she got herself admitted, because she got to know about her pregnancy. She was having all these problems. She was feeling depressed and was having history of depression. So these were the main problems. We do not write in OET about these things, no pain, no this, because we want to save our words. Because I have told you there are more than 300 words and we are just supposed to write only 200 words. So that is where you save your data, not talking about the things which are not a problem of the patient. So again, while I read about the patient, my mind forgets about to whom I am writing the letter. So I try to memorize myself again that I am writing the letter to the community health nurse. I need to tell the community health nurse that this patient was admitted on 6th of January, as a day before she got to know about her pregnancy. Then there were other problems like hallucination, history of depression. So what treatment we gave in these 2 days? So we monitored the patient and we had the blood test for HIV, AIDS, and sexually transmitted diseases. So when the patient was admitted for 2 days, we got all these tests done. We monitored the patient. We gave her the counseling regarding nutrition and pregnancy. RE in OET means regarding. You will get the recorded lecture, so don't worry. Just keep listening, keep focusing. Counseling was given regarding nutrition and pregnancy because she was pregnant. She was counseled regarding HIV, AIDS, and STDs. So she was also counseled regarding these things and blood tests were offered. We discussed about possibility of rehabilitation clinic for driving out, means to quit the drugs. So that was the possibility that was discussed. By chance, if you do not understand this thing in the paper, then OET exam is the easiest, because you don't write this thing because you do not understand it. So don't write it. That is how simple it is. Talking about the social history and medical history of the patient, if I would see that patient's lifestyle, she is having 30 to 40 cigarettes, started smoking at the age of 15. She is right now 21. How do I know she is 21? Because I read over here, her age is 21. So basically, she started 6 years ago at the age of 15 and she smokes around 30 to 40 cigarettes. Drug use, cannabis, amphetamines, cocaine, heroin, she has used everything. It is given in the second form, that means in the past. So she has taken all these drugs. She started all above the age of 16 years, injects heroin, occasionally shares infecting equipment. That means she shares the same syringes, infected equipment. That is why we have got HIV test done, we have got STDs test done, because she uses these things, injects heroin and all these things. Alcohol is not the major problem of this thing, and she lives with her friend Sophie. And history says that she has a suicidal thought tendency. She has a history of depression, self-harm in the past. Now, if you will figure out, you know a lot of thing about the patient in just 10 minutes. You know that patient is pregnant, patient was admitted, patient apne aap, she got self-admitted. Patient got self-admitted because she was having drug abuse problems and she got to know about her pregnancy. Her history is that she is a smoker, she drinks, and she is a drug user or drug abuse. Then she injects and shares the infected equipment. So I know lot of things, and this is the treatment we have provided. Like patient was monitored, patient was counseled regarding nutrition, patient was counseled about HIV and AIDS. So now I know almost everything. The only thing I do not know, which is the main thing of the letter, is the purpose, which I have found it is the ongoing support throughout her pregnancy. But this discharge plan, whatever it is said in the plan, is the main purpose of the letter. Main purpose of the letter means that we are referring the patient to the community mental health nursing required daily for the next 2 weeks. So she requires mental health nursing for the next 2 weeks. So we will tell the community health nurse that she needs, this is the purpose. After discharge, means she is getting discharged today on 8th. After discharge, she needs mental health nursing. So this is the most important thing, purpose. She wishes to continue living with a friend on her sofa. So she is happy with her friend and she needs psychiatric support for her depression. So this is the second main point. First point is that she needs mental health nursing. Second point, she needs psychiatric support for depression. This is the second main purpose. Third, she needs to go to a program Alcoholics Anonymous meetings so that she can quit drinking. So this is also one of the points. She should come for the trimester ultrasound after 2 weeks. So this is given as wrong. It should be after 2 weeks. After 2 weeks, she should come for the first trimester this. And this mental health clinic appointment needed. And also she needs an appointment for the mental health clinic. So now I know everything about the patient and everything about the letter. Everything. I have read everything. Now I will show you how to write an OET letter in the simplest of its way. I will tell you what should be the format of the OET letter. It will just take 15 minutes now to complete this letter. After that, I will take your doubts. So we have read everything about the patient. Now we need to write about the patient to the new community health nurse. So when it comes to OET, there are 4 paragraphs that you need to make. So here I'm just going to take this blank page and now we'll start writing the 4 paragraphs. The first paragraph is the purpose of the letter in brief. Please try to listen to this recording again. You will never have a problem in OET writing. Please listen to it nicely and then we will discuss. So purpose in brief. Purpose in brief, what do you write in the first paragraph? You write why the patient came to you. First point that you will cover. What treatment did you offer? What is the current condition? and what is the purpose, which is the main part of this letter. So that is how you write the first paragraph. So if I have to write the first paragraph, this is one of the trickiest letter. Otherwise, OET's letters are much simpler than that. But I always say, make your first day uncomfortable to make your rest of days very comfortable. So now I will write the first paragraph. Purpose. How do you write it? We follow a pattern. This letter is being written. This you will write daily. Regarding patient name, that is Mrs. Vineyard. Mrs. Miss Vineyard. Because we don't know whether she is married or not, and somewhere it was given that she is married or she is unmarried. So, but we will take this thing into account, but we will write the main things. This letter is being written regarding Mrs. Vineyard, who got herself admitted. So there was a point that was given in the letter that she got herself admitted. Where was it? Here. It was given that patient self-admitted due to concern about pregnancy, confirmed pregnancy test days before. So admitted due to concern about her pregnancy. Now I use the connector. That is what OET needs, sentence formation. So she got herself admitted due to concerns about her pregnancy, which was confirmed a day ago. I should also mention the date. Got admitted 2 days back. 2 days back means on 6th of January, patient got herself admitted due to concerns about her pregnancy, which was confirmed a day ago. She was, now I will write the main point. She was 6 weeks pregnant and was having drug abuse problems. She reported a desire. So I'm just making a story. So that is how simple it is. You are just writing an email. She reported a desire to quit drugs or to cease her drugs. Where it was given? Again, it was given here. That she presented 2 days ago requesting help for the substance abuse problem. She reported a desire to reduce or cease her drug use. So that is where I'm picking up the main line, that she reported a desire to cease her drug use. So I am exactly writing she reported to drug use. So that is the main thing. After counseling and flu blood tests, she is now willing to get discharged. So that is what is the main point, that she is now willing to get the discharge. So that is the main story. I have written everything like a summary, that she was having pregnancy, which was confirmed a day ago, 6 weeks pregnant. She reported a desire to quit this thing. After counseling and few blood tests, she is now willing to get the discharge. She's ready for the discharge now. Now the main thing, however, she needs, what does she needs? Main point, she will require she needs ongoing support throughout her pregnancy. So she is being referred to your community health center. So now my purpose is all complete. The first paragraph of OET is complete. It hardly took 5 to 10 minutes, 5 minutes maybe, because I spent my time in understanding the letter well. Once I understand the letter, once it is clear in my head, I would not like to write everything in the first paragraph. But this is the main thing of the patient: pregnant, substance abuse problem, she needs ongoing support. If by chance you want to make it simple, if you want to make it simple than this, so the main purpose is ongoing support. So you can also write in a simple way. If I have to make it, if I have to make it very simple, suppose if you guys want to make OET further easy, so I will try to write that thing for you as well. This letter is being written regarding Vineyard, who got herself admitted 2 days back due to concern about her pregnancy. After discharge, she needs ongoing support throughout her pregnancy. So this is how simple you can make it. If by chance you are unable to write this much of a story, so this is the purpose, that you are writing regarding Vineyard 2 days back due to her pregnancy, and after discharge, she needs ongoing support throughout her pregnancy. This is the main thing. So she got herself admitted 2 days back. After discharge, she needs ongoing support through. So this is the main thing. Or you can simply write, this is also the purpose of the letter if you want to make it further simple. This letter is being written regarding Mrs. Vineyard, who needs ongoing support throughout her pregnancy. So she is being referred to your community health center. That's it. Even this much writing is fine. So you can pass your OET test with only this line as well. But if you want to score 350, 300 is what we need to pass. That is C positive. 300 marks we need to pass C positive. And this is good enough for C positive, who needs ongoing support throughout her pregnancy. But if you write this as a complete thing, means mentioning only about the strong points of the letter, then this fetches you more marks. Because now examiner will know everything in the first paragraph. He will already pass you in his mind even before he checks the complete letter. Because the purpose of the letter is clear, that she got herself admitted due to her pregnancy, 6 weeks pregnant, having drug abuse problems, reported a desire. She is now willing to get discharged. However, she needs ongoing support, so she is being referred to you. So this is a better way of writing. But if you just want to pass, this is just perfect. This is the main purpose, who needs ongoing. So if we write in detail, if we follow this method, then also the purpose is this only. If we write this, then also the purpose is this only. Because if you will not write it here, then you will write it here. Now the second paragraph. Mrs. Vineyard is 6 weeks pregnant. This I am writing if I have not written information in this paragraph. Then I will write it here that she is 6 weeks pregnant and is having substance abuse problems. Then I can mention here. So I can plan my letter according to my choice. That is what is the best thing about OET. If I do not write these things over here, then I will write in the second paragraph, talking in the medical history or social history. Now I will write, suppose if I do not write this way, if I follow our pattern of 350 points, then now I will mention the SSC point. Mrs. Vineyard is a smoker. Just the main point which you can remember. And smokes 30 to 40 cigarettes. And also she drinks regularly. I am not quite sure whether she drinks regularly or not. Alcohol 8 units per day. Yeah. And she drinks 8 units per day on regular basis. So now I'm mentioning the main points. Main point is also about her drugs. She is She is a drug abuser. But if I want to make my grammar better, then I would like to leave an impression on the examiner. So I will try to make this line better. She has been using drugs since she was 16. So now this is much better. This will give me more marks because she has been using drugs since she was 16. And she has used whatever the drugs name was given, cocaine, heroin, amphetamine, and this. Four drugs were given, so you write it here. So again, you make OET letter very simple. First paragraph is purpose, second paragraph is of social history and medical history. That is the second paragraph. And regarding her social history, you can say her social history reveals that she is not married. I think that was given, she is not married. It was given somewhere, she is not married. Uh, she's a single mother, was given, no, no, no. Mm-hmm, mm-hmm, mm-hmm. Over here, nothing, nothing. Drugs abuse, started above alcohol, started drinking, lives with a friend, no contact with the friend. So this is the only thing. So her social history reveals that she has no contact with her parents and lives with her friend on sofa. Yeah, her friend Sophie, which she wants to continue. So there was a line that was, so I'm just mixing up the things because I want to make my letter easy, because it was given in the plan that she wants to continue staying with her friend. So I've written it over here. She wants to continue the same thing, which she wants to continue. So one of the points I have mentioned over here. This is how second paragraph is all done. So you don't have to worry. It is that simple, that you have written about purpose, you have written about social history and medical history. Now the treatment that you offered, third paragraph. So you say during our hospitalization, yeah, during her stay, she was, now you will use the past tense because the treatment has already been provided. So you have provided this treatment. So patient was monitored, blood tests were done. So you will say she was monitored and blood tests were done for HIV and STDs. That is how simple. You just keep on writing things, whatever you feel like. Then again, second point was she was counseled. So then you write the second thing. She was counseled for nutrition and pregnancy. She was counseled regarding nutrition and pregnancy. Further counseling was also given regarding HIV and STDs. So you're just writing simple things because you're writing. So you're writing to the community health nurse, talking about patient situation, that she is pregnant, she is coming to you for ongoing support, she is a smoker, smokes, so that community health center knows that this is the condition of the patient. She is a smoker, she is a drug abuser. So during her stay, these all things were done. And possibility of and again, when there is a difficult line, just make it simple. Discuss possibility of rehabilitation clinic. So make it simple. Discussion was conducted. You just write this thing. Discussion was conducted. Rest all same regarding possibility of rehabilitation clinic. Same words, same words. Third paragraph is also done. And the word count, That is how simple OET is. Again, word count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So I'm writing almost 15 words in one line. 1, 2, 3, 4, 5. So I've written almost 75 words in the first paragraph only. 1, 2, 3, 4 should be around 45. 75 plus 45 is 110. 1, 2, 3 again around 145. So already my 150 words are done. That 150 around. So now you have only 50 words to write. That is the discharge plan. That is how simple OET is. 3 paragraphs are done. So you don't have to write complete things about this and that. So I have mixed up everything, whatever I found important. I did not write about this 16-year-old, this old. So I wrote the main things: injects heroin, drugs used. I talked about smoking. So I have mentioned all these points. And I should have written about the societal thoughts and self-harm in the past. So we should also say over here that she has history of depression and suicidal thoughts in the past. So this you can write in the social history and medical history. So again, you have mentioned everything about the patient. You have written the purpose, you have written the social history, you have written the treatment. Now the last paragraph, discharge plan. Discharge plan is when we write the community health nurse to do what she wants. It would be greatly, this is the main purpose in detail. It would be greatly appreciated if you can. So now I'm telling the nurse, it would be greatly appreciated. So I'm asking the nurse, it would be greatly appreciated if you could, that is the last paragraph, please, then we will have discussions. So it would be greatly appreciated. Community mental health nurse required daily next 2 weeks minimum. If you could arrange a community mental health nurse on daily basis for next 2 weeks. Why does she need a community health nurse? Because she is having suicidal thoughts, depression, drug usage. So that is why she needs the first thing. Second thing, she needs psychiatric support. Along with this, just use a small thing along with this, a small connector. Along with this, she needs psychiatric support for depression. So in OET, you are not writing anything great. You are just copying paste, copy paste, copy paste. This line we have mentioned that she wants to stay with her friend. Methadone program Alcoholics Anonymous meetings. Meetings should always be arranged. Meetings are something which are always arranged. So same MPAAM, I will write in detail. MPAAM, M means meeting, should be arranged. So in OET, no matter how complex the data is, the only thing I am doing is putting my tenses right, should be arranged. So I'm telling the community health nurse that this meeting should be arranged. I did not do anything. I wrote the same thing, should be arranged. And one trimester ultrasound at after 2 weeks. And please note, I'm just telling the community health nurse, and please note that the patient needs first trimester ultrasound after 2 weeks. And my letter is all done. My letter is all done. This is the complete letter. Mental health clinic appointment needed. So we can say over here, psychiatric support depression and a mental health and appointment at mental health clinic is also required. So I am just mixing up the points so that mental things can be together, and the meeting of dropping the alcohol should be there, and first ultrasound should be there. This I have mentioned. And last, the main important point, the purpose of this letter again, she needs. So Please provide her all the required help throughout her pregnancy. Just to cap the letter. As well. As well completes my letter that please provide her the required help throughout her pregnancy as well. So this should also be done. So this is my complete letter. Now, when you will write the letter, you will not mention these things. So complete letter will look like this. I'm just going to take it this way. So complete letter will look like this. That's how small a letter would look. So you will have the recording of this thing. And this is one of the toughest letter, I would say. This is one of the toughest letter. So OET letters are going to be easier than this. This is your complete letter. That's it. That's it about OET writing. This is one of the toughest letters I'm telling you because the data has been haphazardly. Otherwise, you will get everything arranged. First of all, even in the case notes, patient social history, medical history would be given, then treatment would be given, then plan would be given. So this is how simple OET is. So this is how you write the complete OET letter, which is one of the difficult letters, and you don't mention about the words ever. So don't never write the words in the final paper. So this is like I have written for my final exam. If now when the examiner will receive my answer sheet, it will look like this. Let me read it loud for you. This letter is being written regarding Miss Vineyard. So what I'm doing, I'm reading this letter as a community health nurse because nurse has written the letter to community health nurse. So the person who is getting the letter, who is receiving the letter is community health nurse. Now during the proofreading in the last, I should have a mind of a community health nurse. So I'm reading this letter. This letter is being written regarding Miss Vineyard, who got herself admitted 2 days back due to the concern about her pregnancy, which was confirmed a day ago. Okay. So I'm a community health nurse. I'm understanding that I'm receiving a pregnant woman. Okay. She's 6 weeks pregnant. Okay. Or I can say she is 6 weeks pregnant and is having drug abuse. I can also write in the press because she's still having these problems. She reported a desire, but I'm using that in the past. She reported a desire. So that was prior to admission. So I have to write it in the was. So she reported a desire to cease. After counseling, she is now willing to get discharged. So now she is willing to get discharged. However, she needs ongoing support. This is the main thing. Is a smoker, then I'm talking about the patient social history and medical history. So the community health nurse who is reading the letter now already knows about patient that she is pregnant. She needs my support. So the community health center nurse can understand that this patient needs my support for 30 to 40 cigarettes. So now I know about the social history. I know the counseling has been done, blood tests have been done. So now what I need to do being a community health nurse, I need to arrange a mental health nurse. I need to fix her appointment with for the psychiatric support at mental health clinic. Also, I need to arrange a meeting and also first trimester ultrasound. I should remind her after 2 weeks and I will provide the help. So this is what I am reading who is getting the letter. So again, you can listen to this recording 2 or 3 times and I promise you on the very first day of the commencement of our journey, we have completed our OET writing very nicely. Just listen to it 2, 3 times. Ask us for the doubts. We all are here to help you. So I'm just going to close this recording and we'll take your doubts. This is Dr. Bhupesh from Dr. BKM Institutes talking about one of the trickiest letter of OET, but how to make it the simplest of the letters. Just think like a nurse. Just write like a nurse, like an email, but in the letter form. Write an email, but in the letter form. And always remember to whom you are writing the letter. Select your complete data according to the person to whom you are writing the letter. Thank you. And please go through this recording right now again. If you have listened to it once, do it again. You will be a perfect person, a perfect candidate to pass your OET writing. Thank you.